Picture this. You've just finished a completely grueling workout.
Oh, yeah.
Or honestly, maybe you've just hauled like 12 incredibly heavy grocery bags up 3 flights of stairs because you absolutely refuse to make a second trip.
We've all been there.
Right. And you know that intense sort of lead-heavy feeling in your forearms?
Oh, the worst.
Your grip is completely fried. Your muscles are like practically vibrating. And your hands just will not cooperate to unlock the front door.
Yeah, they're just locked up.
Now, what if you could essentially reset that severe muscle fatigue in just like 5 minutes?
I mean, it sounds a bit like science fiction, but that kind of accelerated, almost immediate recovery is exactly what high-level athletes are constantly chasing.
Right.
Because, when your career literally depends on your grip strength, you can't afford to wait 24 hours for your forearms to bounce back.
And that brings us to the core of today's deep dive. We are looking at a highly specific, brand new 2024 trial published in the Journal of Sports Science and Medicine.
It's a great paper.
It really is. And the title is, it's an absolute mouthful, but it lays out the exact mission for us here. It's called, bear with me, Comparing the Effects of Compression Contrast Therapy and Dry Needling on Muscle Functionality, Pressure Pain Threshold, and Perfusion after Isometric Fatigue and Forearm Muscles of Combat Sports Athletes, a single-blind, randomized controlled trial.
Yeah, they really managed to fit the entire methodology right there in the title. It's a very rigorous piece of scientific literature.
It totally is. And we definitely want to give full credit to the research team behind this work. That's Adrian Kużdżał, Filipe Manuel Clemente, Adam Türkçe, Ireneusz Ryszkiel, and Robert Trybulski.
Fantastic team.
Okay, let's unpack this. The main question here is whether stacking 2 completely hardcore, like really intensive recovery therapies provides superior, supercharged results, or, if simply using one of them is enough to get the job done.
Right, and while the study focuses on elite combat sports athletes, we're really going to approach this with an accessible academic tone, because the underlying physiology we're talking about, it applies to all of us. Whether you're a martial artist or just someone carrying heavy bags, understanding this research is crucial for anyone looking to optimize physical recovery, because we're looking at the actual measurable mechanics of how muscle functionality is restored at like a cellular and vascular level.
So let's start with the physiological battlefield here. We are talking about the forearm, specifically a muscle called the flexor carpi radialis.
Correct.
Why focus on this one specific muscle for these athletes?
Well, if you look at the unique demands of combat sports, MMA, judo, Brazilian jiu-jitsu, these athletes aren't just striking.
Right.
They're engaged in continuous, repetitive gripping and holding. Like, think about grabbing an opponent's bundles in judo and trying to throw them while they actively resist you.
Oh, yeah, that takes a ton of force.
Right, and that is an isometric pull. You are contracting your muscle, but the length of the muscle isn't changing. You're just holding maximum tension.
Which has to burn through energy incredibly fast.
Right. Oh, it creates massive metabolic disturbances. Because when you hold a tight grip like that, you are physically squeezing the blood vessels inside your own arm.
Oh, wow.
Yeah, you're literally shutting off the oxygen supply to the flexor carpi radialis, which, by the way, is the main muscle on the inside of your forearm responsible for flexing your wrist and closing your fingers.
So it's basically choking itself out.
Exactly. And without oxygen, the muscle starts producing energy anaerobically, which leads to severe lactate accumulation and just a rapid depletion of intramuscular energy stores.
So that lead-heavy feeling you get, that's literally a buildup of acidic waste products trapped in the tissue.
Precisely. The muscle becomes highly acidic, the fibers get stiff, and the chemical bridges that cause muscle contraction literally can't release.
Ugh, that sounds awful.
It is. Force production drops, your contraction speed slows way down, and your risk of injury skyrockets because the tissue is, well, it's essentially suffocating in its own waste.
So the researchers wanted to see how fast they could rescue the specific suffocating muscle from total failure. And they brought in 2 heavy-hitting contenders to do it.
You did.
Contender number 1 is compression contrast therapy, or CT. And they used a specific device for this called the Game Ready.
Right. A very popular device in sports rehab.
So how does this machine actually pull the muscle out of that acidic state?
It's a pretty incredible piece of technology. It manipulates the vascular system by altering both temperature and pressure in very precise intervals.
Okay.
So the athlete wears this sleeve around their forearm. And the protocol starts with 1 minute of intense 3 degrees Celsius cold.
Wait, 3 degrees Celsius is practically freezing.
It's very cold. And it's combined with a high pressure of 75 millimeters of mercury, which feels, it feels pretty similar to a blood pressure cuff squeezing your arm really tightly.
Wow, so why squeeze the arm and freeze it at the exact same time?
To force severe vasoconstriction. The cold and the pressure work together to violently shrink the blood vessels. It physically shunts and flushes that stagnant, lactate-filled blood out of the forearm and pushes it back toward the body's core.
So it clears the junk out.
Exactly. But then, the device immediately alternates to 1 minute of 45 degrees Celsius heat.
Oh, like a hot tub.
Yeah, very warm. And with a much lower pressure of only 15 millimeters of mercury.
Oh, I see. So the heat causes vasodilation. The vessels open wide, the pressure drops, and fresh, oxygenated blood comes rushing back into the tissue.
You've got it. They alternate this extreme hot and cold, high and low pressure cycle back and forth for a 10-minute session. It basically acts like an external cardiovascular pump.
That is so cool. All right, so that brings us to contender number 2, which is dry needling, or DN.
Yes.
Now, I know some people hear the word needle and immediately think of getting a shot at the doctor, but this isn't injecting any medication, right?
No medication at all, hence the term dry. In this therapy, the clinician uses a highly specific 0.30 by 30 millimeter sterile filiform needle.
That sounds incredibly thin.
It's very thin. And what happens is the practitioner physically feels the muscle to locate myofascial trigger points.
Like knots.
Exactly. These are those hard, hyper-irritable knots of muscle fiber that have essentially locked up and just refused to release.
And they put the needle straight into the knot.
Directly into it. And sometimes they use a technique where they gently change the direction of the needle under the skin, maybe up to 5 times, to mechanically stimulate the tissue until they provoke a local twitch response.
A local twitch response? Wait, what is actually happening in the muscle when it twitches like that?
It's a spinal cord reflex. The tiny micro-trauma of the needle hitting that specific knot forces the central nervous system to reset the electrical signal going to that area.
Oh, wow.
Yeah, the muscle fibers rapidly contract and then immediately relax. It mechanically disrupts the tight bands of tissue and forces the muscle to finally let go of its tension.
Okay, let me make sure I'm wrapping my head around this. Is compression contrast essentially acting like a giant sponge-like wringing out all the metabolic waste with the high pressure and cold, and then sucking in fresh, nutrient-rich blood with the heat?
That's a great way to put it.
And then dry needling is more like going into a tangled tightrope and manually untying a stubborn knot from the inside.
Yes, what's fascinating here is how these two totally different mechanisms are aiming for the exact same goal, which is rapid recovery.
Right.
You have one broad external vascular pump manipulating the circulation, and one micro-targeted internal mechanical disruption resetting the nervous system.
And the question is, what happens if we use both?
Exactly.
But to test that scientifically, you have to prove they actually work beyond just the placebo effect, which means you need exhausted participants and you need a way to fake the therapies to create a control group.
Right. The methodology here is key.
So let's talk about the setup.
Well, they recruited 45 highly trained male martial arts athletes. These are Tier 2 national level competitors with over a decade of experience.
Wow.
So their baseline grip strength is already phenomenal.
So they aren't going to get tired easily, right? How did the researchers push them to the point of failure?
They used a digital dynamometer, which is a device that measures grip force. The athletes had to squeeze it at 60% of their absolute maximum voluntary contraction.
Okay.
But they didn't just hold it once. They had to hold that 60% squeeze for 5-second intervals, rest for a brief moment, and then squeeze again. Over and over until total muscular failure.
Total failure. Meaning like their brain is telling their hand to squeeze and they just physically cannot obey.
Exactly. Total biomechanical exhaustion. And once they hit that wall, the researchers tracked 4 specific metrics at rest right after the failure, 5 minutes post-therapy, and then 24 hours post-therapy.
Okay, let's walk through how they measured this, because they didn't just ask the guys, hey, how does your arm feel? They got highly technical.
Very technical.
Metric 1 was muscle tension, or MT.
Right. They used a digital myotonometer. This is a handheld device that literally taps the surface of the muscle with a small probe and measures the mechanical oscillations in hertz.
Oh, that's clever.
Yeah, it tells you exactly how physically stiff the tissue is. If the muscle is locked up, the tension score is high.
Got it. Then metric 2 was muscle strength, or FEF max, which is pretty straightforward. They just use the dynamometer again to see how much raw force they could produce in kilograms force after the exhaustion.
Exactly.
But metric 3 is interesting. Pressure pain threshold, or PPT.
Hmm.
How do you quantify pain objectively? I mean, pain is so subjective.
It is. So they used a tool called an algometer. It has a blunt rubber tip, and the researcher presses it directly into the muscle belly, steadily increasing the pressure. The athlete holds a button and presses it the exact millisecond. The sensation of pressure turns into the sensation of pain. It gives a really precise numerical value of their pain tolerance.
That makes sense. And the fourth metric, which is honestly the most sci-fi to me, is perfusion unit, or PU. This measures the microvascular blood flow. But how are they seeing the blood flow inside the arm?
Oh, they used laser Doppler flowmetry?
Lasers.
Lasers. They shine a low-power laser 2.5 millimeters deep into the forearm tissue.
Wow.
And when that laser light hits moving red blood cells, the frequency of the light waves actually shifts. It's just like the Doppler effect you hear when a police siren drives past you and the pitch drops.
That is wild.
The device measures that shift in the light waves to perfectly quantify exactly how much blood is rushing through those tiny capillaries.
Okay, hold on. This is where I have a major logistical question about the methodology. Because it's a single blind trial, meaning the researchers know what's happening, but the athletes shouldn't know if they're getting the real therapy or the fake control therapy.
Right, to prevent placebo effects.
But how do you trick a seasoned martial artist into thinking they're getting stabbed with a needle when they actually aren't?
It's a brilliant piece of study design, honestly. For the sham dry needling, they used a specialized telescopic blunt needle mounted on a tiny spring.
Wait, like a retractable stage knife from a theater production?
Very similar concept. When the clinician pressed it against the skin, the blunt tip retracted into the handle.
Oh.
Yeah, it creates a localized pressure that feels remarkably similar to a needle prick, but without ever piercing the dermal layer. And because the athlete is instructed to look away during the procedure, it becomes incredibly difficult for them to differentiate between the real insertion and the sham pressure.
That is incredibly clever. But what about the game-ready machine? How do you fake a giant compression sleeve alternating between freezing cold and hot tub temperatures?
Well, for the sham compression contrast therapy, they kept the sleeve, they kept the 10-minute duration, and they kept the alternating 1-minute intervals. But they neutralized the extremes. Instead of 3 degrees and 45 degrees Celsius, they used neutral water temperatures hovering between 15 and 36 degrees.
Ah, sneaky.
And they dialed the pressure down to the absolute lowest setting.
So the machine is buzzing, water is moving around, it feels like a legitimate medical treatment is happening. But it isn't actually delivering the physiological shock to the vascular system.
Correct. It completely isolates the psychological placebo effect from the actual physiological mechanism.
Okay, so we have exhausted athletes pushed to absolute failure, incredibly precise lasers and tap sensors measuring their arms, and a flawless control system. Did stacking the therapies create a super recovery effect?
Wow.
Here's where it gets really interesting. Let's look at the 5-minute sprint, the data taken just 5 minutes after the therapies ended. For reducing muscle tension and increasing tissue perfusion, the combined group, the athletes who got both CT and DN, absolutely crushed it.
They really did. The laser Doppler data was staggering. The combination therapy triggered a massive surge in local blood flow and a highly significant drop in mechanical muscle stiffness at that critical 5-minute mark.
So it worked.
Oh, yeah. If you need immediate, palpable physiological relief like getting the blood back in and relaxing the knot, the combination is undeniable.
But then we look at the other two metrics, muscle strength and pressure pain threshold. And there is a massive plot twist in the data here.
A very surprising twist. While the combination won the 5-minute sprint for tension and blood flow, the data showed something completely different for strength and pain tolerance.
All right.
For maximal force production and pain threshold, using just one of the therapies, either only compression contrast or only dry needling worked just as well as combining them.
So getting stabbed with the needle and sitting through the freezing compression didn't make them any stronger, and it didn't make them any more resistant to pain than if they had just chosen one of the two options.
That's exactly what the data shows. And this held true both at the immediate 5-minute mark and all the way out at the 24-hour mark.
Wow.
If we connect this to the bigger picture, it is important to note that doing something was vastly better than doing nothing. All the real intervention groups showed significant improvements compared to the sham controls.
Yeah.
But stacking them just didn't yield a double benefit for strength or pain.
Okay, I have to challenge this because it feels completely counterintuitive.
Go for it.
If we know that CT and DN work beautifully together to flush the system, as we just saw with the huge spike in perfusion, and they clearly release muscle tension together, why on earth wouldn't they stack to create ultimate pain relief?
It's a great question.
I mean, if both therapies individually reduce pain by clearing waste, shouldn't using both mean double the pain reduction? In fact, looking at the tables, the single CT group actually performed best for improving the pain threshold. Why did adding the needle seem to hold them back?
It comes down to conflicting neurophysiology. You're assuming pain is just a result of the metabolic waste. But pain is also a neurological signal.
Okay.
To understand why they didn't stack for pain relief, we have to look at something called the gate control theory of pain.
Walk me through that. How does a gate control pain?
Well, your nervous system has different types of nerve fibers. You have nociceptors, which carry slow, throbbing pain signals from the damaged muscle to your brain.
Right, the danger signals.
Exactly. But you also have mechanoreceptors, which carry fast signals about pressure and touch. According to the gate control theory, if you stimulate the mechanoreceptors enough, those fast pressure signals literally race up your spinal cord and close the gate on the slower pain signals.
Wait, really?
Yeah, your brain registers the heavy pressure instead of the throbbing pain.
Oh, it's like when you hit your elbow against a doorway and your immediate instinct is to just aggressively rub the area.
Yes.
The heavy rubbing is sending pressure signals to the brain that block out the sharp pain signal.
That is the exact mechanism.
Right.
Now, think about what the compression contrast therapy is doing. It is providing a massive, rhythmic, heavy pumping of pressure across the entire forearm.
Right.
So it is heavily stimulating those mechanoreceptors, establishing a powerful analgesic effect by keeping that pain gate closed.
Okay, so the game ready machine is essentially rubbing the elbow, so to speak. But where does the needle come in?
Dry needling relies on creating localized microtrauma. You are inserting a foreign object into the tissue to trigger a biochemical response.
Ouch, yeah.
So the researchers hypothesized that combining them might actually dilute the advantages of the compression. The acute localized microtrauma and the nociceptive danger signaling created by the needle prick might actually interrupt or override the soothing neurological gating effect being established by the cuff.
Wow, so the needle is basically propping the pain gate back open.
Pretty much.
It's sending a sharp danger signal that just ruins the soothing analgesic magic of the compression.
It is highly likely. They have differing mechanisms of neurological action that, when stacked, seem to interfere with each other's maximum potential for pain relief.
But wait, if they interfere with each other for the pain signaling, why did they synergize so perfectly for perfusion and tension? Like, why did they stack so well for the blood flow?
Because the blood flow is a mechanical issue, not a neurological one.
Oh, I see.
Think back to your knot and sponge analogy. The blood vessels are physically trapped inside that stiff, knotted tissue.
Right.
The dry needling mechanically disrupts that tight band. It physically unties the knot. By breaking up that stiff tissue first, the needle opens up the literal physical vascular pathways.
I see. So the needle clears the physical roadblock.
Exactly. Then when you immediately apply the compression contrast therapy, its vasodilation effect, the sponge soaking at the blood, has completely unrestricted pathways to rush massive amounts of fluid into the area.
That makes so much sense.
The needle cleared the road, and the compression drove the traffic.
That paints such a clear picture. The circulatory system can do its job at maximum efficiency because the physical restriction is gone, even if the nervous system is a little confused by the needle prick.
Exactly. It's a trade-off.
So what does this all mean? If you are a martial artist, a physical therapist, or just someone trying to recover from a massive physical exertion, what is the core takeaway from this deep dive into the data?
The takeaway is that precision matters more than volume. If your primary immediate goal is a 5-minute reduction in severe muscle tension and a massive spike in blood flow to flush out metabolites, maybe, in between tournament matches, combining compression contrast therapy and dry needling is the absolute gold standard.
Right.
It is unmatched for acute vascular relief.
However, if your goal is the general recovery of your grip strength and maximizing your pain reduction over the next 24 hours, stacking them is just completely unnecessary.
Right, it doesn't add anything.
A single targeted therapy, either putting on the game-ready compression sleeve or getting a targeted dry needling session, is completely sufficient. You just don't need to endure both to get your strength back.
In clinical practice, more isn't always better. Sometimes a single appropriate technique is all the body needs to facilitate favorable recovery outcomes. Throwing every tool in the toolbox at a fatigued muscle might just dilute the benefits.
It really highlights the importance of matching the specific therapy to the specific physiological goal you're trying to achieve. And we highly encourage you to read the full article in the Journal of Sports Science and Medicine.
Definitely check it out.
The authors provide incredible data tables and a much deeper dive into the exact methodologies, the laser Doppler readings, and the statistical breakdowns that we just couldn't cover today. Also, please make sure to follow the channel and turn on notifications for similar content. We love unpacking these scientific breakthroughs for you.
And looking at this data, this raises an important question for me.
Oh, yeah.
We have seen that these acute 10-minute mechanical interventions can drastically alter muscle biomechanics, blood flow, and pain signaling in just 5 minutes. It's a rapid reset.
Right.
But what happens long term? If an athlete applies these specific therapies chronically over the course of an entire grueling season, how might that permanently rewire their neuromuscular pathways and their baseline pain tolerance?
Wow.
Are we just fixing acute fatigue on a daily basis, or are we fundamentally upgrading how the human nervous system processes exhaustion?
It's wild to think about the long-term adaptations there. Next time you're standing at the bottom of the stairs, staring down those impossibly heavy grocery bags, and your forearms are already dreading that lead-heavy burn, just remember, the secret to untying that knot and squeezing out the fatigue might just be a needle and a cold plunge away.